Good afternoon. My name is Tabitha Beard. Today I'm going to be just taking a look at you and see what we have going on today, okay? Are you first able to tell me your first and last name?
Andy Williams.
Nice to meet you, Andy. Are you able to give me the time?
423.
Okay. And then do you know why you're here and where you are?
I'm at Pecan, Georgia, and I'm here because I have some popping in my knees.
And both knees or just one knee?
Just one knee, my left knee.
Your left knee, is it popping?
Yes.
When did this popping occur?
About 2 weeks ago, while I was at work, I was moving some boxes, and I went down to pick up the box and my knee popped.
Okay. What do you do for work, if you don't mind me asking?
I work at a trucking company.
Okay. And then what do you do at this trucking company?
Kind of a service rider. I move stuff around, do parts.
Okay. And you said that as you were moving something into a truck, that's what
Yes.
happened?
Yeah.
Can you play back the event? Were you like squatting, or were you just bending over?
I was squatting.
Squatting? Okay. And then was this injury as you were going down or as you were coming up?
Going down.
Going down. Okay. So when this popping first occurred, how would you rate that pain? We have a system that we like to use. 0 is no pain at all. 10 is the most pain that you could have felt and that you need to go to the hospital.
I'd say it'd be about a 7.
A 7? And then how are you feeling currently as you're sitting right here?
5.
A 5? Okay. And then at its worst, as you're going throughout your day, as you've aggravated it, how will you rate it at that point? And then what are some things that you've noticed that aggravates it?
I think throughout the day it'd probably be, probably about a 6.
Okay.
Some things that might aggravate it, or that do aggravate it, is walking, going upstairs, getting in the car, going into the gym.
Okay. And then at its best, when you've had some time to rest, what would you rate that knee pain at that point? And then what are some things that you do to alleviate that pain?
I would rate it at about a 4.
Okay.
Just kind of stretching my like my knee, and as well as icing it.
Okay. So just to kind of get some more information about you as an individual, do you currently take any medications? It could be prescription or over the counter.
No.
No. Okay. Do you have any allergies? It could be food or just outdoors allergies.
No.
No. Any medication allergies?
No.
Okay. So no allergies. All right. What does your home life look like? Do you live with anybody? Do you live by yourself?
I currently live with my girlfriend.
Okay. And this home of yours, is it an apartment style? Is it a townhome? Is it a house?
It's an apartment style.
Okay. Are there any stairs or this an apartment? Within the apartment, sorry.
No.
No. Okay. Just to kind of get more information about you, like I said before, do you currently smoke at all?
No.
Do you drink any alcohol?
No.
Oh, okay. And then do you have any like pre-existing health conditions such as diabetes, hypertension, high cholesterol that I should know about?
No.
Does your family?
No.
No? Okay. So with this knee pain, prior to this knee pain, how were you moving about? How was your normal activities?
It was fine. It was easy to move around.
Okay.
I'm just guessing that when lifting up that heavy box and going down with it and then picking it back up, over and over again, it gave me that popping sensation.
Well, I mean prior to this pain.
Oh, prior to, it was fine. Fine. No popping, going down. I just kind of don't know what happened with this time around.
What about like at home, outside of work?
No, everything's fine. Perfect.
Okay, but then currently with this pain, how does this affect you?
It's harder to squat. Other than to pick stuff up, it's just like a constant pain and then a little bit of popping over and over again.
Okay, I'm so sorry to hear that. So within this therapy, I'd like to hear back from you. What are you looking to get out of this treatment?
Looking to get out of it, just a bit of relief. Hopefully it may not go away right away, but over time, doing some more therapy sessions and alleviate some of the pain and stretch it out and hopefully get better.
Okay. Is there anything that I have not asked you that you would like to tell me?
No.
No? Okay. So now before I actually just focus more so on your knees, I actually want to clear two upper segments just to make sure that that pain isn't coming from either two segments, okay?
Oh.
I'm going to first look at that lower back, and then I'm going to move more distally and look at your hips, okay?
Okay.
So I'm actually going to have you stand up for me. And I'm just going to have you just do what we like to call active range of motion. So you doing the movement yourself, just so I can see how well you're moving, okay, through each motion.
Okay.
So firstly, I'm going to actually have you bend forward and try to touch your toes. And then come back up for me. And then I'm going to have you do a similar motion where you kind of go towards the back of the room. And then come back up for me. Nice, I'm going to pivot around you. Are you able to just slide that right hand down that right side for me? Go to your right, and then come back up. We're going to do the same thing, but to your left. Nice, and come back up. Okay, so your lower spine seems to be fine, that lower back area. Now I'm just going to do the same thing, that same range of motion at your hips, okay? So you're able to turn around towards this bed for me. I'm going to actually make it a little bit higher for you, just because we want that posture to maintain upright. Okay, can you grab hold? I want you to kick that left side, that left leg, as far back behind you as possible. Just kind of look at that hip. Nicely bring it back down. Okay, and then you can back away from the bed a little bit. I should lower it and then have you have a seat back on this bed, okay?
Okay.
Okay, go ahead and have a seat. You can sit on that stool for me, or put your feet on that stool. Okay, I'm just gonna pump it up just a little bit. Okay, nice. All right, so I'm gonna give you some support here. Are you able to lift this left thigh towards your chest as much as possible? Okay, I see this is giving you some discomfort.
A little bit.
A little bit, okay, but not that much. I can just tell it's kind of maybe coming from that knee area. All right, and then you can lower it down for me. All right, are you able to bring that inner part of your foot inward like this? And then can you bring it outward the other way? Okay, any discomfort with that?
No.
Okay, nice. And you can plant that foot back for me. Okay, so your hips seem to be fine, and everything seems to be moving as well. So now I'm just gonna focus more so on the knees, okay?
Okay.
All right, so since we're still here, I'm just gonna have you still do the active range of motion. So you're facilitating the motion yourself. So are you able to kick this left leg out in front of you as much as possible? I'm gonna apply some resistance. Don't let me move you, okay?
Okay.
Nice. And then try to kick it up under you as much as possible. Is that okay? Is that painful?
Yeah, it is painful.
So on that scale that we discussed previously, how will you rate it?
So about a 6.
A 6. Okay. I'm gonna apply some resistance outward. Don't let me move you, okay? Okay. So just for my documentation purposes, I'm gonna say my numbers out loud for that strength assessment. I would give that strength for extension like a 5 out of 5. However, I would mostly deem that flexion strength like a 4 out of 5. All right, so not necessarily weak, but it is weaker than your extension. So you're bringing your foot back is weaker than bringing your foot outward, okay? So now I'm just gonna do some simple palpation just to kind of get my hands more so on that knee joint itself, okay, to see how things are moving around. All right, so are you able to lay back for me? Step away. Gonna bring it to my hip. All right. Are you still okay?
Yes.
Okay. Is any of this motion painful side to side?
A little bit.
What's a little bit?
It's probably about, I can definitely feel it, but it's probably about a 4 right now.
A 4?
Yeah.
Okay. How about these motions?
Yeah.
How would you rate those?
I would say right about 6.
6?
Yeah.
Out of 10? With 10, no, 10 is that you need to go to the hospital, that we half the salt, just to give you a relative point.
Okay.
So is this still a 6?
I'll say a 5.
5? Okay, so are these still 4s?
Yeah.
Okay. Alrighty, so now what she's gonna do, since you've already done your active motion, I'm actually gonna assist you and kind of doing those same motions up and down. So let me grab a towel. Place this underneath your leg. Okay. This is what we like to call passive range of motion. It just means I'm facilitating the motion for you. Okay. I'm going to go ahead and get my tool lined up. Okay. Lateral malleolus. Here. Extension. Okay. Now I'm going to actually move your leg myself.
Okay. It hurts.
Right there.
Yes.
Make sure I don't get any rotation. Where all of my landmarks are lined up. Shy of 90 degrees, so you're at 0 to 88 degrees. I'll remove this towel. Now 0 to 88 degrees for flexion. Passive range of motion. Alrighty, so now have you sit up for me. Get this back under your leg, or your feet, and lower you down. So now these next set of tests are just gonna allow me to see that your reflexes as well as your dermatomes and that your nerves are intact. The first test that we would do is called the light touch sensation test. I'm actually gonna show you what it feels like on your hand. So I will stroke your leg at different points and you'll say, yes, I feel it, or you won't respond. This next test will be the sharp and dull test. So if you either feel like this, you would indicate that it's sharp. I would touch you with the dull side, and you would indicate that it's dull. Okay? And then last but not least, I will test your reflexes at 2 different points. One being the patella tendon, the next being your Achilles on the back of your ankle, and it's just going to feel like this. Okay?
Okay.
Like a slight pressure.
Okay.
I know it looks a little intimidating, but it's not. Okay? So I will actually have you close your eyes and look away for me. Roll your right leg up. And you let me know if you feel this, okay?
Okay. Yes. 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 Yes.
Alright, next test. It's gonna be the sharp and dull. So I'm gonna have you do the same thing. Look away and close your eyes. Again, just indicating which is which.
Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Dull.
Nice. Okay, so now we're gonna move on to checking your reflexes. I'm actually gonna remove this shoe if you don't mind. And just roll down this sock. she's gonna have you press your hands together and then look away from it. You can keep your eyes open this time. Okay. Nice. Both of your reflexes are intact, as well as your donor tones. Okay. Here's your back. Let me put that these out of the way. Alright, so upon what I felt when I was palpating your knee, I also have like a conclusion as to what I think. I want to do 2 final tests just as confirmation. The first one is going to be Apley's compression test. That's just going to be, I'm going to have you actually laying on your stomach, and then I'll do a series of what we like to call flexion. That's just bending your knee, and then I'll apply some compression onto your ankle, kind of pushing the tibia into the table, or tibia into your femur, and then into the table. And I'll just be looking for that grinding, clicking, popping that you said you felt before, and then it's kind of that catching as well.
Okay.
And then I will perform another test called the McMurray's. It's kind of doing the same thing or looking for the same thing in my eyes. It will give me the same positive results if it is indeed positive. Except this one, you will be lying on your back. So the first one I will perform, since you're already sitting right here, will be the McMurray's. I'm just gonna have you lay on your back for me, okay? With your head facing this way. And you let me know if any of these become too uncomfortable.
Okay.
Okay. So I'm gonna take your leg through a series of flexion. I remember that you said that this caused you pain, and this was your method of injury at the beginning. So I won't try to, what we like to call hyperflex your knee, or just take you beyond that range. Okay? I want you to bring your finger down. So okay?
Yes.
Okay, you're gonna load. Let's take you in and out. Okay, bring it just a little bit more. Already feeling that catch and that hard stop. There you go. Okay, nice. I want you to flip over for me on your stomach. Okay, I'm gonna do the same thing. Bring that foot up. I'm gonna hold here, compress. Okay. Set the table. Do something very simple. Oh, it just popped. Okay. Still okay?
Yes.
Okay. You can relax. Now, throughout the duration of the video, I only tested his left side for various tests, just because of the time constraints. In a real patient setting, I would test both sides bilaterally. And you're able to sit up for me, you can relax. I will get this stool back under your legs. And I want to thank you for allowing me to do your examination.